Hi, today I'm going to talk to you about chiropractic and ear infections. Yes, chiropractic and ear infections. Hi, if you don't know me, my name is Dr. Christopher Chase, and I'm a chiropractor here at SoVita Chiropractic in Derby, Connecticut. So, let's start. Chiropractic and ear infection. It is widespread. It's the most pediatric visits under the age of 15. So, the most visits to a pediatrician under age of 15 is for ear infections or otitis media. So it's very widespread. Now, I do this lecture for parents all the time. So what I'm going to do, I thought, let's put it on YouTube. So I'm going to be referring to my notes because it has lots of studies of how chiropractic is effective. Also, I'm going to go over normal anatomy of the ear, and I'm going to go over what the normal treatments are for otitis media, the pros and cons, and I'll go over what the research says about chiropractic and ear infections. Because most of you are probably thinking, what does a chiropractor do with childhood ear infections? You probably think, oh, I thought they were just good for low back, neck pain, car accidents, and you're right, we're awesome at that as well. But a lot of people don't know about chiropractic and ear infections. So I thought I'd do this video. Actually, I just had a patient today. His child was having chronic, recurrent ear infections, and he didn't even know that we did that. So I made this video to help people out that have children that have chronic ear infections, and they've been through all months, maybe years of infections, and they're still not getting the help that they want. So this is why I'm doing the video. So let's start. All right, so antibiotics is the #1 treatment method for ear infections. So I'm going to be using some stats. Some of them are a little bit older stats, so they're probably higher than what they are today. So this is back in 1990. It was 20 million prescriptions for otitis media were filled, with 25 million office visits for pediatricians for otitis media or ear infections. That was in 1990, so I'm sure the number's higher than that now. So it's widespread. Typically, 10% of 3 months of age. 3 months of age. Every time I look at that, it's still shocking. 10% of all the infants 3 months of age or younger will have an ear infection. And then 50% of all children under 3 years of age will have recurrent ear infections, or at least have 3 or more episodes of otitis media. So that's a lot. So half of all kids before the age of 3 will have recurrent ear infections. So that cost is 5.3 billion per year. 5.3 billion per year, and that's coming from the Pediatrics Journal in 2000. So in 2000, it was 5.3 billion. That's a ton of money. So I'm sure we're in 2020 now. That was 20 years ago. So I'm sure it's more than that. All right, signs and symptoms. What do you look for? So if you have kids, the first thing to do is put the grab in their ear. They're irritable. They may have a fever. If you look into the ear, they'll probably have redness in the ear and a bulging of the eardrum. Also, listlessness. They just don't want to move around. And the worst one is, of course, loss of hearing. All right. So what's the cause? What causes this? So 70% of the time, it's due to a bacterial infection. And 30% of the time, it's due to a viral infection. Now, a bacterial infection is usually a hallmark is pain, fever, inflammation, bulging of the tympanic membrane, and sometimes you can have an ear infection without the pain. It'll just be bulging and you'll have an opaque or amber color in the tympanic membrane or the eardrum. So hearing loss is the most common side effect, and that in itself is horrible, but also affects language development, also behavioral development, social skills. So it affects everything with a child's growing up. All right, pathogens, what causes it? And it's streptococcus is the main one. And it's multifactorial, so there's many causes, and there's a big debate on what causes it and whatnot. So let's go over a few let's discuss a few of the causes. The first one is called eustachian tube dysfunction. Eustachian tube dysfunction, and this is the one that I really think that's happening, what's going on. So let me explain it. So your eustachian tube goes from your inner ear all the way to the back of your throat, or the nasopharynx. Now, in an adult, it's oriented like this, and it's on a slant because the fluid will roll downhill, right? In an infant, a baby, a child, it's horizontally situated, so fluid doesn't drain as easily. It gets stuck there, and then it can get infected with bacterial or virus, cause otitis media. Now, this eustachian tube, the normal function is to allow drainage and to allow equalization of pressure, your inner ear, to the environment. That's what it does. Now, there's a couple different options pediatricians use. And I'm going to get back to the eustachian tube dysfunction in a minute, but let me go over what the standard treatment is with pediatricians. The first option is called the observational option. So this, according to the American Academy of Pediatrics. Now, some of these slides I'm just going to read verbatim because it's just that important. Pediatrics, American Academy of Family Physicians Clinical Practice Guidelines. This is 2004. The management of acute otitis media and observation option for acute otitis media is recommended. Okay, so that's what they recommend first, observational option. So what's that? So that option is deferring antibiotic treatment for 48 to 72 hours. Limiting management to only symptomatic relief, so just helping with the pain. So the observational option is from 48 to 72 hours. No antibiotics, just help the child with pain. That's what pediatricians are supposed to do. Okay. So they did a study with the criteria for observational option, and the otherwise healthy children 6 months to 2 years of age with non-severe illnesses. And what did they find out? Well, when they did that, it actually increased bacterial resistance when they just did the observational method. So it helped. So the American Academy of Pediatrics, they did a survey of all the pediatricians in the United States. They wanted to find out how many pediatricians are actually doing the observational method first. And they found out that it was only 15%. So only 15% of the pediatricians are actually doing that. All right, so the next approach is called a WASP, or wait and see approach. So wait and see, or wait and see and then prescription. Wait and see, prescription. So WASP. And it's to reduce the amount of antibiotics given to children. The approach encourages parents to wait 48 hours before filling the prescription. So what did the studies find? At 24 hours, 64% of the children had decreased symptoms. That's pretty good. And by 7 days, it was 75%. It's even better. So if they just waited 48 hours before filling the prescription, 24 hours before filling the prescription, 61% saw better symptoms. It decreased their symptoms. They felt better. And by 7 days, 75% of the children felt better. All right. So antibiotic therapy is the number one therapy that pediatricians use. And it could be different antibiotics. It could be for different days. It's usually 7 to 10 days. All right, so there's problems with the antibiotics. So the first thing is antibiotics kill everything, kill all the bugs. So they actually kill the good bugs, or what we call gut flora. Now there's flora that lives in our intestines, our stomach, that actually helps the baby and us as adults maintain our health. So we need them. Antibiotics kill everything. So in emergency, antibiotics, that's what you're needed. But over time, chronic antibiotic use really affects the gut flora and lowers your body's health. So it's not good. All right. So once you limit or kill the flora, you may have to use stronger and stronger antibiotics. So that's the danger with that. The second is surgery, or the tubes in the ear, and that's for chronic otitis media with effusion. So there's 500,000 were performed in 1996 alone, so I'm sure that number's increased. Now the reason for tubes in the ear, chronic ear infections, pain and discomfort, so the tube in the ear allows it to drain and allows equalization of the pressure. And that's the second way. Now there's risk to the surgeries. So this comes from the Journal of American Medical Association. This was 1994. So they did a study that said 27 to 32% of all surgeries involving tubes in ears were unnecessary. So 27 to 32% unnecessary. There's also risks. You have to put the baby or the infant or the toddler. You have to knock them out, get them to sleep. So there's troubles with that. Some are just the anesthesia or sedation. So just the medications to put them to sleep to do the surgery is a risk. And then also the eardrum also gets, it's called persistent tympanic membrane perforation. Just means that the hole in the ear, it doesn't heal up, and that adds to the loss of hearing, which can create behavioral problems, speech pattern problems, socialization problems. Okay, so eustachian tube dysfunction, getting back to that. So it does a few actions. The first is it drains, or it protects the ear from fluids, bacterial and virus infected fluids reaching the inner ear. That's one. Second, it regulates the pressure from the internal middle ear to the environment. And third, it drains fluid back into the nasopharynx, the back of the throat. That's what it's supposed to do. Okay, so there's a muscle that controls the opening and closing of the eustachian tube. You think of a tube, there's a muscle around it, and when the muscle contracts or squeezes it, it can open it or close that tube, allowing fluid to drain. That muscle is called a tensor veli palatini muscle, and it's controlled by a nerve, because you remember nerves control muscles. The signal comes from the brain down through the spinal cord, out through the nerve to the muscle. That's how it works. And the nerve is from the mandibular branch of the trigeminal nerve. So bring it here. Okay. So according to Dr. Fish, otitis media has 4 elements. 1, it's usually in younger kids. 2, it happens in the winter months. Well, that makes sense. The kids are inside more. They're not getting out into the fresh air. They're probably stuck in there with other kids, and which brings up daycares. So because usually both parents have to work these days, daycares, you have to put your child in daycare. That's what it is. So you're around other kids getting sick as well. And then the eustachian tube. So remember, in adults, eustachian tubes oriented like this on a slant. In kids, it's more horizontal. So fluid backs up, can get infected with bacterial. 70% of the time is bacterial, and 30% is viral. Other factors, some I just mentioned. One, being in daycare, so being around other children. Another is bottle fed, males, the male gender, and history of taking antibiotics in the past, and if they have siblings, brothers and sisters that have chronic ear infections. Birthing history, probably didn't even think about this. So if your child was a C-section, remember a normal vaginal birth is when the baby goes through the birth canal, and that molds the skull. Because remember the fontanelles or the bones in the skull, they get molded when the baby goes through the birthing canal. In a C-section, of course, it doesn't happen because they don't go through the canal. So how that affects is it doesn't mold the skull properly, and it can change the pressure in the ear. And that pressure difference can cause eustachian tube dysfunction, which can lead to otitis media or ear infections. So antibiotic therapy, that's the most common form of treatment. It's usually 7 to 10 days, and 98% of all patients going to the pediatrician, that's the therapy they receive. And of course, there's antibiotics don't work on viral infections, and they don't work on allergies. Antibiotics are only recommended in bacterial infections. Okay, natural history. If you do nothing, 80% of all ear infections usually get better on their own within about 3 days. So that's something to think about. Complications of ear infections are rare, but they're bad. So one of them is meningitis. So that's inflammation of your spinal cord. That's not good at all. Mastitis, there's a bone right here, the back of the ear. If you feel that, that's your mastoid. So that gets infected, and that's very painful. That's not good. And of course, recurrent attacks, recurrent otitis media, and then finally hearing loss. And then hearing loss, you get the behavioral. You could have behavioral problems, linguistic or language development problems, also socialization skills as well. All right. Surgery, if they can't control the ear infections with antibiotics, then they usually go to the tubes in the ears, the surgeries, and the tubes stay in usually for 6 months. Again, what the goal of the tubes in the ear is to help with the drainage, help with the pressure, equalize the pressure from the inner ear to the environment. All right, so let me talk you. That's the common. So it's wait and see, which most pediatricians don't do, and then it's antibiotic therapy. And if the antibiotics don't work, then it's tubes in the ear. That's the standard. Okay, let me tell you what I do as a chiropractor. Okay, so I'm going to go over that. And I'm going to talk about the literature, the science behind this. Now, in chiropractic science, it's a little different than medical science. Now, in medical science, you have the pharmaceutical companies that pay for all these studies. And the studies are millions and millions of dollars. It's a lot of money. My profession, unfortunately, does not have millions and millions of dollars to do on studies. So what we do is we do case studies, retrospective studies from different offices, different doctors with different patients, and we pull all that information together, and we come up with a study. There's also small studies, cohort studies, where we have 20, 30, 40, 60 of patients undergoing care versus a placebo. So there's some of those studies too. But there's a lot of case studies with chiropractic, a lot. So many, you can't ignore it. There's so many good positive results. So let me go over a few of them. Okay. So the first one is chiropractic safe for kids? Because when you think of chiropractic, some people think, oh, you're just for low back pain, neck pain, headaches, car accidents. And like I said before, we're great at that, but we're used to seeing adults. And some people think chiropractic is aggressive. And what I found out that it's not true. And it's especially not true in our office, where when we adjust a child, we use the amount of force that you use to check the ripeness of a tomato. That's right. So picture yourself feeling a tomato, see if it's ripe, and you're squeezing it. That's the amount of pressure that we use adjusting a child. So that's not much. I also use a handheld instrument. And this instrument can be set or calibrated to infants, toddlers. So it's not hard at all. So I wanted to put that out there. But that being said, chiropractic thought, well, let's do a study, see how safe it is. So this is the study I'm going to go over. All right, so they had two groups. They had one group, one set of children that got the adjustment, and the one set of group got a placebo. And the placebo was they just touched their neck. That's it. So this is what they found. All participants were required to attend 10 treatments over a 4-week period. Compliance was excellent. The results showed no serious side effects from either the active treatment or the placebo adjustments. There you go. So the adjustments were just the same as just touching your neck. That's awesome. Okay. So it's safe. Okay, let's go for the first study here. Now I'm going to read this. The aim of a cohort non-randomized retrospective study of 46 children. Okay, so 46 is a small study. 46 children, 5 years old or younger, was determined if patients improved under chiropractic care. So the first research was, is it safe? And here's the first one saying that, hey, kids improved. So let me read this. The treatment regimen consisted of 3 adjustments per week for 1 week, then 2 treatments per week for another week, and then 1 treatment per week. Treatments were returned when treatments were terminated or stopped when there was improvement. So 93%, that's huge. 93% of all episodes improved while under care, and 75% improved in 10 days or fewer. That's awesome. 10 days or fewer. And 43% had improved with only 1 or 2 treatments. So this study shows how chiropractic care may decrease the symptoms of ear infections in young children. That's awesome. It's a great study. And this came in the Journal of Manipulative Physiologic Therapies, so in 1996. All right, this next study, this is probably the biggest study with children chiropractic. This was with 650 children. That's a lot of kids. 650 under chiropractic care were studied. Otitis media showed positive improvement and was the only one of the immune complaints that were examined. So what they did is the authors feel that there may be a factor in a child with otitis media that is not necessarily caused by an immature immune system, which is a theory as to the onset and cause of otitis media. So this study substantiates this theory by showing that 80% under the standard medical care experienced ear infections. Okay, 80% standard medical care, antibiotics, tubes in ears, 80% got ear infections versus only 31% of children experienced otitis media under chiropractic. So the kids under chiropractic care getting adjusted had only 31%. Kids doing the traditional way was 80%. Okay, another case study. This is another big one. 332 children, aged 27 days, so brand new baby, little infant, to 5 years old, with the otitis media chiropractic adjusting care using tympography as an objective measuring tool. So they looked at the eardrum. So they found that they looked for what's called a subluxation or a misalignment, and they used static palpation and motion palpation, where they gently move the baby's head and neck and kind of push on it. That's motion palpation. Static palpation is what you think. It's just pushing in. That's to look for the misalignment of the vertebra or the bones in the neck. So if they found a misalignment, then they would give an adjustment. So each child was given a series of chiropractic adjustments according to the findings, and the results of this study indicate there was a strong correlation between the resolution of otitis media and the chiropractic adjustments. So when the child was getting adjusted, they got better. It's awesome. Okay, there's many studies of chiropractic and kids with ear infections that do well. So I'm gonna read you just one or two more, and then we're gonna wrap this up. Okay. Here's the first case was involved a 4-year-old boy with otitis media undergoing 2 years of antibiotic therapy with negative results. So this child was doing antibiotics for 2 years. 2 years. And negative, still getting ear infections. So the chiropractor found a misalignment in the upper part of the neck, and the chiropractor adjusted or did the treatment. And what they found was that a dramatic improvement was reported within 2 weeks. All right, so this was a tough case. This kid had for 2 years recurrent ear infections, antibiotic therapy, and usually, with the other studies I presented, usually a couple days to a week. But this was 2 weeks, so this took a little bit longer. Still, great results. And it's a case study, so it's a case study of one. So all you detractors out there that are looking at this video is like, oh, you didn't do the research of 1,000 people. Well, right. I got it. There's limitations. But for that kid, it made a difference. And for that family, it made a difference. So I'm glad the chiropractor published that. That's great. All right, the second case is a 6-year-old male underwent 3 years of, all right, this is worse. So 3 years intermittent antibiotic therapy, and now being advised to have tubes in the ears. Okay, so they did 3 years. They stuck it out for 3 years doing this antibiotic therapy. And now teachers say, okay, let's do the tubes. Hey, why not? 3 years. Okay. So 2 sets of tubes. Wow. So 2 sets of tubes were inserted, and the first set did not alleviate any complaints. So they had to do a second set. This kid went through a rough childhood. The second attempt was also unsuccessful. Oh, I forgot about this study. This is horrible. So this is 3 years, antibiotics. Parents waited, and then tubes in the ears, 2 sets. And even the second set was unsafe. So these parents were looking for a solution. So somebody probably told me, hey, why don't you try a chiropractor? All right, so they went to a chiropractor, and the chiropractor found a misalignment in the upper part of the neck. The mother reported that by the 4th adjustment, the child had not complained about his ears. 4 adjustments. 4 adjustments. Folks, just consider this. 4 adjustments. And this was from Journal of Chiropractic Pediatrics, 1996. And this was Dr. Larry Webster, his study. Now think about Larry Webster. I got a soft spot for Larry Webster. Now, if you don't know anything about chiropractic profession, there's not many of us. There's only 50,000 in the United States. So there's not many chiropractors. So there's a few chiropractors that stand out. And Larry Webster's now deceased. He passed away. But he actually started the whole pediatric. Chiropractors have been adjusting kids since the inception of chiropractic. But Dr. Larry Webster kind of organized it more. So he was considered the father of chiropractic pediatrics. So had a lot of love for Dr. Larry Webster. So he actually taught me. So I was in his first class that he was teaching. So I'm honored to be one of his students. So part of the reason why I do this video is because Larry Webster influenced my life, and he helped a ton of kids doing the same thing, just doing adjustment. So this is one of his case studies. All right, one more. Okay. The next was a child. At the child's second visit, he had already reported that he felt better. Follow-up adjustments were given 3 times a week for 2 weeks, then twice a week for 2 weeks, and then 1 time a week for 6 weeks, and he continued once every 3 weeks for 6 months. Okay, the child's otitis media was resolved in this case with chiropractic care. Okay, that's pretty standard. That's what we're seeing. The amount of visits, the length of time. Great study. That came from Dr. Pete case study in Journal of Chiropractic Pediatrics. Okay, so let me wrap this up. If you made it this far in 30 minutes, I know this is a long video, but if your child has recurrent ear infections and antibiotics aren't helping, or you're considering tubes in the ear, then at least consider chiropractic care at our office. Consider it. At least you can come in, you can talk to me, have a consultation for 5 minutes, and it doesn't cost you anything. And we'll talk about what we do, what we look for on the child, how we work. I'll answer all your questions. And if you want to, we'll bring the child in, we'll go through an exam, see if he or she has those misalignments in their spine. Now, if you like this video, please share it to your friends or family, somebody that has a child that has chronic ear infections. Share it to them. Like I said, I had a patient that has kids, and he's a patient here. He didn't even know I worked on kids. So I told him today. So people don't know that this is a natural option to look for. Now, I want to be clear. I don't treat ear infections. What I look for is called a subluxation, or a misalignment of vertebra. If we find that and we adjust that, the body from these studies tend to heal up. Great results. Can't guarantee results, but from the studies and from my personal experience, kids have done very well under chiropractic care. So I'm Dr. Chris Chase. Hope you enjoyed this video. Please comment, like it, share it, do all that fun stuff. And if you want to make an appointment for a consult, please do so. I'm going to leave the website and the telephone number, all the information in the little description area of this video, so you get all the information there. Dr. Chris Chase, I'm your chiropractor in the Valley. Have a great day. Talk to you soon. Bye.